guys, welcome back to my channel. So today I will be discussing a very important topic for your nursing career, to become a nurse, to clear your medical surgical examination, or to clear an Nclex exam, that is heart failure. And you will see a lot of these cases in hospitals, long-term care homes, that people are actually living with congestive heart failure. So to make it easier, I have broken down the video in just 3 parts: the description, the assessment, which also covers the signs and symptoms, and the third part is the management. What exactly is heart failure? So the description of heart failure is, just remember 3 words: inadequate cardiac output. When the heart of the patient is unable to pump sufficient amount of blood to all the body organs, that is called heart failure, which will ultimately result in inadequate peripheral tissue perfusion and will further result in pulmonary edema, that the fluid will keep accumulating in the heart and there will be a backflow on the lungs, resulting in increased amount of blood, increased amount of fluids in the lungs, hence pulmonary edema. And if heart failure is not treated, if the acute episode of a heart failure is not treated, it will ultimately result in cyanosis and death of the person. Of course, if you imagine, if a patient's body parts are not getting enough oxygen from the heart and ultimately the brain will not get oxygen, you guys know that our heart has 2 sides, a right side and a left side. Therefore, there will be 2 types of heart failure, either right-sided heart failure or left-sided heart failure. Any which way, it will result ultimately in the second heart failure and hence altogether heart failure. But initially it starts on one side. There is a trick to remember: L for left, L for lungs. So in left-sided heart failure, the signs and symptoms are more pulmonary based. And for right-sided heart failure, the signs and symptoms are more of systemic based. That means your bodily signs and symptoms. So let's move on to assessment. So how will you assess it is a right-sided heart failure? There will be bodily symptoms such as leg and sacrum edema, jugular vein distension, abdominal distension. This is because all these fluids, all these backflow of the fluids are accumulating in the body, resulting in enlargement of all the body organs like hepatomegaly, splenomegaly, which is enlargement of spleen, hepatomegaly is enlargement of livers, anorexia and nausea. There is so much fluid in the body, the patient will keep feeling nauseated and feeling to vomit. There is weight gain. Obviously, fluid accumulation will result in weight gain. Nocturnal diuresis. At bedtime, patient will feel an urge to urinate. There will be swelling of fingers and there will be swelling of hands. So these all involve the bodily symptoms, or you can also call it as systemic symptoms. Then moving on to left-sided heart failure, L for left, L for lungs, so pulmonary signs and symptoms, such as there will be signs of pulmonary congestion. On auscultating, you will feel the patient has crackles. Then there will be dyspnea, like difficulty in breathing, tachypnea, crackles in lungs. There will also be dry cough because all the fluid is accumulated in the lungs but nothing is coming out, so the cough will be dry. Then is paroxysmal nocturnal dyspnea, which means that after 1 or 2 hours of sleep, the patient will start feeling dyspnea, will feel a difficulty to breathe, but as soon as the patient will sit up in an upright position, the difficulty in breathing goes away. And ultimately, these 2 things, any which way, the heart failure will lead to cyanosis, that is the bluish discoloration of the body from insufficient tissue perfusion, which is a late sign of heart failure, which might ultimately result in death. Moving forward, we are now going to discuss the management of the heart failure. So in heart failure, there can be an acute episode, which is usually more common in young adults, and then more commonly the older adults, they live with a chronic episode. And even in chronic heart failure, an acute episode can come in if proper dietary measures are not followed, or even if proper medication regimen is not followed. As a nurse, how to manage an acute episode, I have made an acronym for you guys to remember better. So for A is administering oxygen. We know now in a patient with heart failure, the heart is not able to pump oxygen to all parts of the body, so a source of oxygen is needed. For C, the client has to be in high followers position. The person usually becomes a mouth breather, so you have to make the patient sit up to breathe efficiently through the mouth and through the nose, and so the proper airway is open. Next is urinary catheter and diuretics. So a urinary catheter has to be placed as per the need of the patient to let all the body fluid out of the body, so there is no urinary retention in the patient, and you have to administer a lot of diuretics to let that fluid out of the body and to let your heart be offload that fluids, to let the weight off the heart. For T is to place an intravenous access device so that the patient can get IV antibiotics, IV diuretics, and all the IV medications. And for E is intubation or ventilator support due to pulmonary edema. So the patient will have a lot of pulmonary edema, a lot of fluids, a lot of infection or inflammation in the lungs and pulmonary tissue. So there might be a ventilator support needed. So that should be placed. Moving on to the chronic continuing care management, I have seen a lot of patients, a lot of residents in long-term care homes that actually live with heart failure, which is very common these days. So if they follow a proper dietary regimen, if there is a proper medication regimen, fluid restrictions throughout the day, they can live a very good life with heart failure as well. So the first part is the medication regimen. So there are certain medications that a patient with heart failure takes for a long term, like digoxin, which will help in the heart rhythm and heart rate. It basically provides strength to the heart. Then is diuretics to let all the body fluids out of the body so that the person does not have any fluid retention in the body. There will be ACE inhibitors and vasodilators. For diet, the patient has to follow low sodium diet because sodium results in water retention in the body. Low fat diet for obvious reasons, and low cholesterol diet, so all those lipids are not stored in the blood vessels of the patient. And then there has to be a high potassium diet. Why is that? Because the patient is already on a lot of diuretics, are removing a lot of potassium from the body, so you have to tell patient to eat a lot of potatoes, bananas, coconuts, mushrooms, and all these kind of things. Then there has to be a proper weight gain monitoring. Make sure the patient does not gain a lot of weight. The patient is usually, these kind of residents, I see they're on fluid restriction per day. There is certain liter of fluid that they have to drink in a day. The fluid is not like you drink the whole water in the day or you drink all the water in the evening. No, it has to be proper management. It has to be properly splitted throughout the day. And such kind of patients are instructed to suck on hard candies so that they do not feel thirsty. A lot of popsicles are given to them so that they do not feel a lot of thirst. There are other tips, like they should be avoiding isometric exercises, a lot of gym to avoid a lot of pressure on their heart. So these kind of little things will take the patient a long way, and these kind of things can come in your Nclex exam. The patients are also instructed not to take over-the-counter medications like aspirin, because these kind of medicines, they contain a lot of sodium, which is not good for the patient. So yeah. So the last section of my video will involve what kind of questions you might get for Nclex for heart failure. And I believe that a lot of questions can come, like case studies can come on heart failure, and you can also get a SATA for heart failure, like select all that apply in a right-sided heart failure or select all the sign and symptoms of left-sided heart failure. So now you know that right-sided is more systemic sign and symptoms and left-sided is more lung and pulmonary sign and symptoms. So these kind of questions can come around heart failure. So that was all for today. If you like my video, hit the like button and subscribe to my channel for more educational videos. Bye now.